So welcome to the Board of Health meeting. We are here to continue a conversation that we had a couple of weeks ago, and this basically deals with fentanyl test strips.
Correct.
So you were supposed to bring us back some new and compelling information of whatever it was you were going to find, and I guess we're here to listen.
So what we did was we reached out to a lot of our community partners who we thought would have input, whether it was pro, con, or indifferent, as far as fentanyl test strips goes, to see, because I hadn't really checked in with everyone as far as fentanyl test strips in our community, to see what the desire would be to bring them here. So I did do that homework. I'm going to share some of the feedback of some of the folks who can't be here today, so I'm speaking on their behalf. We have, I believe we have Morgan from Axis, right, on there, and I don't think we have Rick yet. But where I'd like to start is, if we can, with our CIP team, because they're probably going to have to leave for a call. So if that's okay with you guys, we'll hear what they have to say first. So, and, or you can sit in a chair, whatever works. Yes.
People on Zoom said they cannot hear you.
I can talk pretty
Test,
loud.
test.
Okay. Do I need to start over? Okay. So CIP would like to carry the fentanyl test strips on our van to dispense them to appropriate clients while providing substance use treatment resources and follow-up check-ins while using motivational interviewing to relieve ambivalence. So it would just be a good starter tool to build that trust is the way I look at it. Any questions?
Thank you, Charlie. Okay. Do you have any questions, commissioners?
Commissioner Copenhaver, do you have any questions for Charlie? Commissioner Copenhaver, can you hear me? Do you have any questions for Charlie?
So they're wanting to carry them on their van? Are they just going to dispense them?
So it sounds, well, I'll let you speak to that.
So yeah, I think you missed most of my little paragraph here that I wrote, but we would use it as a harm reduction tool to build rapport and hopefully continue to follow up with these people to get them into treatment. So we wouldn't just be handing them out to substance users without using it as an intervention to get them the help that they need.
Does that answer your question, Commissioner?
Yes. I I don't know. I'm like Jim. I have some. It just worries me that we're setting somebody up to have a problem. That's what worries me. It worries me that they'll test 1 out of 10 pills that they've got, and if that tests good, they're going to take the other 10. The other 9, they don't care, and they could all be the ones that have fentanyl.
Or,
The one they tested
or
may
hand
be
them
good.
out. That's my
Yeah.
concern, and that's, as I expressed it last time, we're not, I mean, I understand that you're trying to come at it from a prevention standpoint, but in reality, we're promoting, and this is an opinion, we are promoting illegal drug activity to continue on the grounds that we might reach somebody to get them into a care facility, but we have we really have no data that shows that this is even, well,
So it is evidence-based to start with harm reduction.
I understand harm reduction. However,
But that's what this is. That's what they mean by harm reduction, the studies they've done, the large-scale studies of addiction treatment, starting with harm reduction, like safe use sites, or fentanyl test strips, or needle exchange programs. Those are all considered in the bundle of harm reduction. Narcan is not harm reduction.
No,
That's
it's not.
already harm has
Yeah.
happened. So
Understand
those
that.
3 fall under the umbrella of harm reduction, and studies are showing that does decrease use overall and increases safe use. Not increases use, but increases safety of people using.
I
So
understand that.
that's-
So it increases safety, but we're still,
And
it's an illegal activity that just,
but it increases access and to care is what the studies are showing.
Okay.
So the data that they have collected on harm reduction programs do not show that it increases use of people that aren't already using. So that's not something that comes up.
and where are these studies taking place at?
So that's through ASAM, the addiction.
Where at? Where are they at?
So they have what's it called? I'm blanking on the word. They have large studies that are across the country nationally. I'm on call. I'm so sorry.
Okay, you're fine.
So here's what I'm wondering if we should do. If I was just going to say, if nobody has any more questions for Quinn or Charlie, what I'd like to do is if we could move to Morgan at Access Health, who maybe could give us more description of, because you work in harm reduction, is my understanding, and could you give us a little bigger picture explanation of harm reduction and how you all at Access would utilize fentanyl test strips? And I see we have Rick Jacobson on here now too. So how about we let the two of you kind of lead us next steps here?
Sure, thanks. Rick, do you want to start or do you want me to go? I think that was a go ahead. You were muted. Okay, he said go ahead, so I'm gonna go ahead. Hi everybody, I'm Morgan Williams. I'm one of the Behavioral Health Assistant Directors with Access Health System for our community-based programs. And yeah, harm reduction is a really big piece of what a lot of our community-based programs and the CIP program there under our crisis and residential services perform. Access as a whole really is, our goal is to make sure that we give necessary resources for safe use, but also, like Charlie stated in her paragraph, getting people into treatment to support that. Harm reduction is a really controversial topic. It has been for a long, long time, and I imagine that it will continue to be for all of eternity, at least in my lifetime. And one of the biggest and easiest ways for me to explain harm reduction and the benefits of it are not just in substance use, but in everyday life, we take these behaviors that have risk or that have the potential for harm, and we approach it from a lens of how do we make said behavior safer, So, we wear helmets. We're a helmet state here in Colorado when we ride motorcycles. I wear a helmet every time I ski and every time I mountain bike because I want to protect my brain from a harmful activity. I wear a seatbelt when I drive a car. You know, as a teenager and in college, they stress safe sex through the use of condoms and birth control. That's what we talk about when we talk about harm reduction. And there have been many studies, and excuse me, I don't know the woman's name who's not coming back, but to back her up, there's been many studies both nationally and internationally to show the efficacy of harm reduction as an approach to support treatment and intervention from a substance use perspective. Portugal is actually one of the only countries in the entire world that has decriminalized substance use 100%. And over the course of the last 20 years, 2 decades, they have noticed a 50% reduction in infectious disease rates and overdose risk just by decriminalizing and offering support and connection and community to the people who are using. That's one of the biggest factors that we think about when we talk about harm reduction is how isolating and lonely addiction can be, and how we as kind of a community want to come together and support these people, and help them make better choices, help them make safer choices. Harm reduction by any means is not necessarily condoning use or saying that use is okay. It is 100% strictly just acknowledging that use happens. I think we can sweep substance use and mental health under the rug all day long and say that it doesn't exist or that we're not going to approach it in a healthy way, but that's just going to increase substance use and mental health in our communities. By bringing it out into the open, by having conversations about it, and by being able to support those people, we can have positive change, even in just small amounts. And so harm reduction really is just that. It acknowledges the risk in use. It acknowledges that these things happen in our community. And by bringing it out into the open, it gives us a different way to support people who might be using. So, Rick, would you add anything?
Just what I'd like to add, I agree with everything what Morgan said, and I would like to add that it has been proven that harm reduction does help reduce, just by testing the drugs using the fentanyl strips will help reduce deaths from overdoses and the use of substances that we don't feel, that the user feels like it's going to have fentanyl in it, and then it does. So it definitely helps prevent a different drug user being able to overdose from fentanyl when they weren't intending to use fentanyl at all. So.
Thank you, Rick and Morgan, for that. Does anybody have any questions for Morgan or Rick from Axis? Any? Commissioner Copenhafer, you have any questions for either one of those?
It just morally it sounds, and I can understand their prevention thing and all the examples she used as to how we prevent this and we're preventing that, but all of those activities she talked about are legal activities, not illegal activities. That's the difference here. They're doing an illegal activity and I don't know. It's hard for me to justify that we're gonna hand out things for them to test for.
So I'll just piggyback onto that, and I hear what you're saying, but we have other harm reduction measures that we use and distribute every day in the health department that could be legal usage or could be illegal usage, such as our lock boxes. We hand those out at least 1 or 2 almost every day. So again, people are going to make choices for their own lives. What we're trying to do is, if we have the opportunity to have someone think twice and maybe save their life, that's what this is about. That's what the lock boxes are for. You know, if parents are using, what we want is we want them to keep their kids safe. So someday, hopefully, they'll stop using. But until people are ready for that, that's not going to happen. And we have a due diligence to help people and to save lives. So that's pretty much that's how I summarize harm reduction, and I appreciate your explanation, Morgan and Rick, for contributing to this conversation. And I spoke with Rick by phone the other day, and you know, when he mentioned, you know, when you, like what you just said, Rick, with the, you know, say you have the meth addict who, I mean, everything is laced with fentanyl at this point. We have to think that everything is. But, you know, if you're a meth addict and you don't want to use fentanyl, you can test it to make sure there's not fentanyl in that meth. So that's one of the many reasons that these strips are valuable. So for everyone. So what other? Oh, and then Access. If we do sign up to get these fentanyl test strips, we would be. There's several community partners that we would be working with and sharing those test strips with, and Access would be one of them. So.
So could Access get them on their own? Why do they need it in the community partners?
I'm going to let, I don't know if you guys heard Commissioner Candelaria, but he wants to know if Access can get them on their own. I'm going to let you answer this, Rick, since we talked about this, and if you can give an explanation to that question.
So last week when I talked to the state, the CDPHE, where we utilized the bulk fund for Narcan, they stated that that we were to go through the health departments in each county that we serve in to be able to be provided the fentanyl strips.
The program that CDPHE is specifically is for local public health agencies to distribute to individuals, organizational partners, anyone that we feel, and this is a grant-funded program. These test strips to us are free, and they are free. The grant continues until June of '24. We did get approved, and it's arriving in a week about, naloxone. So, and I got quite a large order, and I will be sharing that with community partners as well. So, and we can continue to reorder as needed. And again, the fentanyl test strips, they kind of go in unison, even though the naloxone is not harm reduction, it's life-saving. The fentanyl test strips are harm reduction, and if they do the strip, still choose to use, or they do the strip and it's misleading because they are not 100% safe. The behaviors that are occurring are risky behaviors, period. People are making risky choices, yes. But this is a tool that they could have in their toolbox to maybe think twice if it does show fentanyl. So, and that's really all this is. So I'll be quiet. Go ahead, Ian.
Yeah, this is Ian McLaren, the county attorney. I guess this is a question for Access or anybody who can answer. Are these test strips available to private entities? I mean, could somebody go out and buy these test strips from a company? I mean, surely this is not just coming from the government. That's not the only place these things are available, right?
I think you're right, Ian, and maybe Access knows the answer for sure. I don't know that you can go just to Walmart and buy them. I don't know if you can.
But certainly an entity like Access would have some kind of access to these sort of test strips if they were to pay for them and then hand
Well,
them out.
they have had them, and they are giving them out in leaps and bounds. They're going sort of like hotcakes. So, you know, and they've been paying for them, the same as the sheriff has been paying for his naloxone. We will be giving him naloxone. So, you know, it's working with our community partners. So.
I guess I would just go back to the point that there is a difference between a government actor doing something and a private entity doing something too. I think that it's important to make that distinction.
So at this point, why don't I move through some of the other community entities I've talked to? Yes? that sound good? Okay. So I did talk with Sheriff Nowlin, and the sheriff was in favor of it as long as we include a component on education and information as to where to seek help when they're ready, which we were already going to do that when we set up our program. But I'm not putting time into setting up the program until we're moving forward with it. So that's kind of where we're going to go with it. There's definitely going to be an education piece. You don't just hand these strips out to anybody who wants them. So I'm not quite finished with law enforcement, but if you want to. Okay. Okay. So, and the other piece, I did speak with a detective, and he basically felt that we would do better and if we pursued a naloxone campaign, which we're simultaneously doing, and we just got awarded for that. And then he also wanted us to develop a campaign in our community to basically get the community to assist law enforcement if they see activities and try to encourage people to help report incidents that they might see that might, you know. So he is willing to sit down with us and help us, you know, develop a campaign if we want to do that. His time is very limited, obviously, but you know, he has some key ideas of what a campaign could look like. So we could work with our county PIO on that and kind of all these things in unison is what I'm envisioning. But so that's pretty much it for law enforcement, unless you want to hear what the coroner had to say right now before you talk. Do you want to hear what? Okay. So I spoke with George Devers, the county coroner, and he is very much in favor of doing fentanyl strips. He is concerned for the youth in particular in our community. He shared with me the total overdose death numbers. He did not have specific fentanyl-specific death numbers at the time, but, you know, say it was about 2 years ago, we had one. Oops. Playing musical mics. 2 years ago, there was one. A year ago, there were two, and last year, there were 8. So clearly, overdose issues are a problem and continue to be a problem for our community as well as other communities. So that was the county coroner's input for that. Our county emergency manager, I spoke with Jim Spratlin. He was in favor of it and definitely felt CIP input was important, hence why I reached out to Charlie and Quinn are here today to share their thoughts on it. And I have some others, but I'll be quiet and we can hear what you, oh, finish? Okay. I'm on a roll. So Dr. Asha Atwell with Street Medicine, she is absolutely in favor of all of these harm reduction measures. They already hand out fentanyl test strips, and they also use naloxone as well. But if they have the opportunity to get some more so that they can continue to hand out and educate people on its use, they would like to do it. I spoke with Matt Lindsay over at EMS at the hospital, and he is 100% in support of fentanyl test strips. He said EMS will be behind it. They will remain neutral in their practice, though, because it doesn't really fit to be on the rig in an emergency situation handing out fentanyl test strips. He just doesn't see that they would be actually using them, and he doesn't want to take them and have them on there and not use them. So, but he had a couple ideas, some suggestions too of places we could use this. But he said the CIP absolutely should have them. He said the street medicine should absolutely have them. And he said public health should absolutely move forward with this from his perspective. And they already hand out some naloxone. His suggestions of some ideas were he could see these being utilized quite well in a bar setting. And possibly school-based health clinics. So those were his ideas. So, and pretty much I was going to talk, but we have Access on here, and they pretty much offered what they are doing and the history behind harm reduction. So, and then I have a vision of what that might look like in our department, but go ahead. I'll be quiet for now.
So it sounds like this is doing it or have done it in the past, and then somebody else you just said, this street medicine?
Medicine. Mhm.
Are doing it currently. So if it's already being done, and I get what you're saying, because then that way they don't have to purchase it, this would be a grant-funded program, we could give it to them and distribute it. So
It's being
is
done-
that the key, is they're doing it because of a cost reduction to them, or are they going to continue to do it one way or another?
They're still going to do it whether
Okay.
whether we have them or not.
So it's already happening? It's already
To a
going
certain
on.
population, yes. Street medicine doesn't serve every person in this community.
I understand that, but
And neither
whoever
does
they're-
Access.
Whoever they're getting with
Mhm.
is who they're servicing.
And I don't
I mean,
know how
CIP
the street
doesn't
medicine is.
get every person in the community. I mean,
No.
I get that. I
Mhm.
mean, there are
Right.
different realms that everybody or people go to.
Right. But there's a whole population in this community who won't be touched by Access, CIP, or street medicine. What about those people? That's our job,
Yeah.
so.
Okay. Well, again, I'm going to ask you the question. It doesn't matter if we approve this or not.
Right.
You can do it tomorrow.
Right, I
without-
understand.
Without our permission,
Right.
without our input at all.
Sure.
I understand what you're trying to do is to get us to be behind you on this. I've thought a lot about this. I came to you personally,
Mhm.
and I'm not going to change my decision on this one. I think that we are promoting something that
Mhm.
is just not the right thing to promote. And at some point in time, this again is just my opinion, not anybody else's, but I'm going to state my opinion, is that it's got to stop. And we were all given a choice at birth to make decisions. Some are good, some are bad, some are really bad, but we all had a choice. And we've all been educated. The education is out there, what fentanyl can and will do. So don't do it. There comes a point in time where you have to say no. And we can't continue to try and
So, and
The
I
edu-
realize that there was a campaign years back, just say no. That was a huge push. I don't think that that strategy works, or we wouldn't be where we are.
or have we
So,
allowed so many other ways to get there
thank you guys.
that it isn't working because of that. So,
I don't know.
like I said,
Yeah,
on this one, I personally stand as I don't believe in it.
Mhm.
I won't get behind it. I understand that you can do this. Totally get it.
Mm-hmm.
I just don't think that we're promoting the proper message here. And we'll agree to disagree on this one, pleasantly and
Right.
politely.
right.
I just don't, I'm not behind this one.
And
And that's where
I
I'm at.
totally, I hear what you're saying, I do. There's not a lot of detailed reporting we have to do with this. We have to report back to the state how many we give out, but we don't report who we give them to. How, none of that. That is not at all what this is about. But we will be tracking, how many we give out. And we totally can give you guys feedback as we progress with this, what this looks like, and we can talk to our community partners. Is it helpful? Are these things just sitting on your rigs, or are you actually educating and passing them out? We can gather
Just
all that
because you
information.
pass them out does not assure
Oh, no.
or guarantee that they're even going to be used.
Mm-hmm.
That's what I'm saying. I'm not sure that we're.
No, there is no guarantee.
Collect that data. collect
Well, we're
the
gonna
data.
count. We're just
Well, you
gonna
know who
count.
you hand it out to, but then who do they hand it out to, and whether it was or wasn't used? You can't collect that.
No. I'm just using numbers. Say we gave 50 to CIP. In 2 months, I called Charlie and I like, how many did you give out? We don't have any left. Or we haven't given out one. Great. That's all I want to know. You know, I don't want to know how many you gave out, how many people you educated, who they were, what they're taking. That's not where we're going with this.
I understand.
There's no tracking with that.
Yeah.
But that would be all the feedback we'd get, you know, is it useful? Is it beneficial? Are you using it? If not, we might do this and it might be a big old flop and the whole community doesn't want the fentanyl test strips. If it's not, we won't continue it. But if people are using them, and honestly, if we save one person use this strip and keeps them from dying, that's one more life saved. And we have this opportunity. So that's where I feel like we in public health have an obligation to bring a tool to this community for them to use if they want to. And they may come and get those strips and may never use it. That's on them. There's nothing we can do about that. But we provided it and we gave them the education and the support and knowing where that connection is when you are ready to make a change, if that time comes. So it's an opportunity.
If that time comes.
Yeah, but that's the way with anyone who
So-
has any addiction.
I'm not going to say anything else because I've said all I need to say.
Right. No, I understand. And I don't know if you were done.
Gerald, you got anything?
My phone was ringing. I had to mute you off. I don't know. It just concerns me that we're condoning bad behavior. That's all it concerns me. And I understand trying to save people from it, from using it if it would test positive. I just,
Here's my opinion. Is if
I guess
they're testing
my
it-
feeling is that most people are not going to test it. They're just going to use it. If they're at a party and they're going to use the drugs, they're going to use the drugs. I don't think they're going to test the things. I don't.
No?
Until then, just getting my
Ian?
mom went my pop and then put it over his eye.
That's all right. I mean, I hear what Gerald is saying, and to take an opioid-based drug and overdose on it, we're saying it's okay to make it safer to do? I have a real moral obligation with that. I've been in and around people that have overdosed on drugs. I've administered Narcan as well as you have. And I just can't bring myself, I wrestled with this a lot. I can't bring myself to that point to say, yeah, go ahead, it's safe. When it's not. It's an opioid-based drug and it's not safe.
But that's not what we're saying. Nobody's saying it's safe.
I understand
You're safe from
exactly what
overdoing
you're
on
saying.
fentanyl.
You're saying, here's a test strip, here's a tool for you to use to make sure that, or it's not 100%, so you can't make that statement either. To have the potential to test, to see that you may not take that tonight. But that's still not preventing the overall, to save lives is to get them off. And I understand what you're saying. The studies say that, okay, now they've had a test strip, now the light goes off in their head, and it's like, but it is. It really is. You got to break it down back to the simplicity of there are addictive personalities and there are non-addictive personalities, and it can be absolutely, and it could be anything. It could be food,
Donuts.
donuts. It could be everything. Absolutely.
That's not,
So
there's certain people that are addicted to different things, but it's not,
I would agree.
yeah, there's not a
But
specific personality.
we also have had the education since young that there are sometimes, like I said, there are do's and don'ts in life. Don't do that. It's going to hurt.
And some
I'm
people.
not saying it's a death sentence. You create the death sentence. You individually, at some point in time, you are responsible for yourself. Why do we in public health all have to say, we're going to protect the world, when in reality that's not true? We can't do that. You have to protect yourself. You have to be responsible for yourself. If you're dealing with illicit, absolutely drugs that are not even legal for whatever reason, don't do it. It's that simple.
Not
You
for
have-
everyone, though. It's not that simple for everyone.
I understand that.
Yeah.
It's not that simple of, no, I don't want to do this anymore. There's a lot of people that don't want to do this anymore and keep using to prevent withdrawal. And the supply chains are getting more and more laced and more dangerous. And if we have tools available to make people safer so that they can live to the point that they decide they want to get sober, then I think it behooves us not to provide
Like I
those.
said,
Yeah.
I'm done.
Is
That's
that-
Yeah,
I mean,
that's
it's-
okay.
it's
Yeah.
your purview to do this, but,
Right.
no, for
Well,
me.
we don't have the support of our Board of Health moving this forward.
Not me.
No, we don't. Well, you're a no. Commissioner Copenhaver's a no. That doesn't mean that public health isn't going to move this
Correct.
forward.
And
So,
I
so.
I want
understand
to hear
that.
your results. I
Yeah,
really do.
absolutely. And
understand that.
I want to see what it does. I don't know what it's going to do. I don't know if people are going to be receptive to it or if we're going to have a bunch of strips sitting around for 2 years. I don't know what to expect. So,
I
you
hope
know.
not. I hope you're very
Yeah,
successful.
I hope so too. I hope that we are able to save some lives and potentially
I just
get
wanna
some
know
people into a
the
treatment.
data of how you really, from what you've told me, there's no way to know that you're going to save a life.
You look at
If s-
overall overdoses in your community with these resources. That's what the
Right.
studies are based on. Number of overdoses, number of people seeking treatment. And then a lot of them have diseases, infectious disease as a metric. And they compare communities with and without harm reduction programs. And those look like safe use sites, fentanyl testing, and needle exchanges. Those are all examples of harm reduction. So all three of those things decrease those metrics. Those are the metrics you look at. Not what did this person do with this test, or you don't track each little thing you're doing. Because you can't. But you can say what's available in this community and what do their numbers look like compared to before those things were available.
So if we had 8 overdoses this year, is that what you said? That was-
Yeah.
8 or
That's what George, when I talked to him by phone, and he said this year, so I'm thinking he means 22.
Right,
8
yeah.
with a potential, there was one that he was still waiting for final result on, so there were 8 in 22. So,
So 8 out of a populace of 26.
right, but you look at trends. It was 1, then 2, then 8. So, I mean, that is what population-based health does. It looks at trends. Because you can't just pick, 10 people to study, right? You got to look at the trend. And so we clearly have a trend here of an increased use. And I listened to the sheriff's report today, and I didn't have the previous ones to compare to, but I mean, we clearly there's a drug problem here. I mean, clearly,
Oh, no,
with tons and tons of
Well,
drugs,
it's-
right?
well,
nobody's
gonna argue
Absolutely,
that.
right. But if we have a tool that might save one life, that's what we're after.
Correct. That's a metric of success too with harm reduction, is increasing access to care.
Increasing access to care is having more access to care.
We're trying. We're doing our best
That-
out there.
That's access
That's-
to care.
yeah.
How about taking that money that we spend on all these fentanyl strips and putting it to access to care? I mean, come on, we've got to
So-
have access to care. That's the big
So let me,
800-pound gorilla in the room.
so
We've
the
been-
SWORD, you're familiar with SWORD, right?
Yes.
Southwest Opioid Response. Okay, so SWORD, which we currently sit on, Laurel is our representative and I'm the alternate. And she apologizes, number one, that she couldn't be here today, but she did want me to speak on behalf of what SWORD is doing. And they are utilizing funding right now to help with this particular issue of treatment. And so they are currently working on a feasibility study to gauge what is needed in this region. That is what SWORD is working on right now. So, you know, there is movement. It's not necessarily in the public health department, but there's movement in this region because we all think that we need it. So we're actually doing a feasibility study on, do we need it? And I can't remember the name of the company that they're contracted with, but that's what they're doing and trying to ultimately bring recovery services to our area. So.
Our gaps in care for our counties are harm reduction, but the biggest ones were harm reduction and then inpatient level care, which in a small community is hard to run sustainably. But we do have outpatient doctors that take care of people and that are struggling with addiction, and I'm not full. My husband's not full. I know the recovery center's not full with the number of patients, like for the providers that are working. So there's that available, but we are missing that harm reduction.
And one thing that Laurel did say, and I think it's good to put this little plug in here, is remembering that this issue that SWORD is working on, which is the opioid reduction, right? Remembering that this issue was caused by Big Pharma in the first place, and all we're trying to do is save lives. So, which is what we're asking for. So, our vision in the health department, and I've talked with all my staff, but not specific staff who are interested in doing this, but I would love to basically have a team of employees who are comfortable having these conversations, delivering the education piece to individuals who would like to have the fentanyl testing strips on hand and naloxone. We're going to educate all of our staff on how to administer that, but I would like to have a team, so about 4 or 5 people, so that when we get someone who walks in off the street and wants to have fentanyl testing strips, I don't want to just hand them. I want to make sure they know how to use them. We'll give them written information, written directions too, but also have a conversation about, you know, if and when you are ready to make a shift. And some people who are going to use these might not be habitual users. That's just the reality. The person who goes to the bar, you know, they might just go to the bar every Friday night and have drinks with their friends and walk away from their drink and come back and drink something that might have something in it. Right?
Yeah,
So
they used to put breath analyzers in the bar until it became a competition.
well, it's again another tool for people to use, and you know, I think that there is a potential place for its use in a lot of different areas that the 5 of us here might not even think of all the places where it could be used. So that's my vision for how we're going to move this forward, is have a select few people who are very comfortable having these conversations with other individuals so that they can be educated properly and sent on their way, and a contact for them to call if they have questions. So we're not just going to have them sitting on the counter to go out the door. Okay. I appreciate you all listening to us and listening to all sides and all aspects of it. Just like Morgan said, this is a controversial, anything harm reduction is controversial. It is. And I totally understand that. And I respect those viewpoints. So please know that. And by us moving this forward, I'm not being disrespectful to you guys' opinions.
No, it's not taking that.
It's just what we have an obligation in public health to provide for our community. So, okay.
The other component is that CDPHE is pushing this, and we, to a certain degree, or through the state, which is their office, has been tasked with it, correct?
Yes, I wouldn't say I just want to, the pushing part, I reached out to them, okay? Because when I heard about it, I was like, maybe I need to learn more about this. So
the offering of it,
Mhm.
not pushing. Maybe I apologize. My
It's okay.
vocabulary was not correct at the point in time. But some of the struggles that we have with CDPHE is the left arm doesn't know what the right arm's doing, and it's back and forth. And the last 3 years have given me a whole different perspective of anything that CDPHE pushes out. So that's just a
I totally
Just a
am in
whole
agreement with you.
different
I
element to
understand.
this.
I do.
And
I do.
again, you know where I stand.
Mhm.
Publicly, I will always state where I'm at with it.
Mhm.
So I guess we're on 95%. I can support what you do, and 5% I'm not going to support what you do. I guess that's still.
Yeah. And
By
it's
percentage, I just don't.
right.
I think we're promoting the wrong thing.
Mhm.
Or you are promoting the wrong thing.
And that's the
I
that's
keep blaming it somebody else.
the yeah, blame the state. That's the thing with harm reduction, right? It is controversial. Some pieces of it are easier swallowed, like lockboxes. That's a harm reduction program for us to be handing out those boxes because we're reducing the potential harm to children. That's what we're doing. That was the intention when we first started that lockbox program. Since then, it's been used for other things that might be harmful, but that was the initial reason to prevent child abuse.
So
That's
I would
why.
like a lockbox. It needs to be about 6 foot tall, about
Yeah,
4
no.
foot wide.
That's called a safe. No.
Yeah.
Yeah, you want one of those? Well, no, we don't pay for those. Sorry. But we already have some of these measures in place. It's just not necessarily such a controversial topic, I guess is what I'll say, They can be. They can be both. Either or.
They could be either, but it's to protect children from things that they shouldn't. Which could be illegal drugs, it could be prescribed drugs. We don't know.
I say, you have to be responsible. Okay,
But
good.
Okay.
We're gonna get into it.
okay, we're this Board of Health meeting is adjourned, right?
Thank you, everybody.
We know where you're at. We know where we're at, and I think respectfully.
Yeah, absolutely. It's all respectful. This entire discussion, everyone on Zoom, thank you so much. This is completely a respectful conversation, and I appreciate all of your input. I appreciate everyone who spent time talking with me, giving me their input. The CIP team being here, this is valuable conversation. I hope, if the public's listening to this and if they have any input, I would love to know what the public thinks about this. Either to us in the health department or to the commissioners, and because I think this is something that we have an opportunity to bring the community, and, this is public, but we didn't have any public here, but hopefully somebody's listening out there. So anyway, thank you.